Hello, I'm Adeze Anyawu with Soap Note Week 6 with United States University FNP 597 Clinical Residency and Practice with Dr. Jenny Brady. My patient initials J.H. Date of birth 12/4/2004 is a 17-year-old Hispanic American young male who arrived to the clinic with his mom, reliable historian. They are here for a well child exam. The clinical chief complaint was, "We are here for the annual doctor checkup." J.H., a 17-year-old Hispanic American male, states that he is feeling good but does not elaborate nor engages with any light conversation upon attempt. He has no significant medical problems or surgeries. The mom states that she is worried about his mental health as he has become more withdrawn and appearing depressed since his father passed away from COVID in February 2020. The father medical history was significant for hypertension. The mother denies J.H. having recent injury, bleeding, shortness of breath, cough, or a fever. The mother also reports that he has been less active and more withdrawn and seemingly depressed. The last wellness exam was December 11, 2020, and he is up to date with immunizations. His last eye exam was 12/12/2020, and they were bilateral 2020. The patient states that he is not sexually active. He has received the Moderna vaccine, both doses. He lives in a residential home with his mom and maternal grandmother. He does not have siblings, and he is a high school senior. And he denies suicidal ideation. Primary medical, past medical history, none of significance. He has no medical problems, no surgeries, no psychiatric hospitalizations. He has no allergies. He's not on any medications currently. As we stated before, father has history of hypertension. Mom does not have any medical history. Maternal grandmother has hypertension and gout, and paternal grandmother is unknown. The patient denies smoking or other forms of tobacco, such as chewing, denies alcohol use, and denies recreational drug use or illicit drug use. Patient states that he is on a regular diet. Mom reports that he does not exercise, and patient denies use of caffeine. Patient states that he is currently still a virgin and has no sexual history. Occupation: J.H. is a high school student. He states feeling safe and secure at home. Review systems include everything since it was a wellness exam, and the constitutional denies fever, nothing of significance for constitutional, nothing of significant for pulmonary, cardiovascular, musculoskeletal, inflammatory, neurologic, GI or GU, or GYN, definitely for psych and mental status. It was a flat mood in effect, and he denies suicidal ideation. Vital signs are normal. His height and weight are normal for his age. He is 5'7", weight is 121 pounds, BMI is 18.95. He's normal, even though he's a little bit on the low side of normal. This the focused physical assessment, he's awake, alert, oriented ×3, no signs of acute distress. He's withdrawn, flat mood in effect. He's healthy appearing, although he has a low mood. He denies chest pain, good pulmonary chest movement, normal skin color and temperature, no deformities or lesions noted, full motor strength, full upper and body range of motion, and good bilateral vision. Differential diagnoses include possible major depression, possible anemia, poor nutrition, intake, and bereavement. The final diagnosis that we're using in this case study and SOAP note is bereavement, ICD Z63.4. JH, major life changes or influencing changes in mental health and personal health status. So for a diagnostic test, we're going to want to make sure that he's not experiencing physical health changes. I know that he's going through grief. So we're going to draw labs, BNP, CBC, and want to evaluate for diet and nutritional deficiencies, and also signs of if he has anemia. Our plan of treatment is counseling regarding ongoing grief processing, consultation with a school counselor, and consultation follow-up with a pediatric primary mental health provider that the family chooses to use. So why did I select this therapy? One, this is one on my list of requires, so that's one. And two, this is something that is affecting the world and the present population currently with COVID and the pandemic. So I think this was kind of more pertinent. And although it's not something super something that you can pull that with medications, this is something that is important and pertinent to today's environment. Support for our plan, we have school support for counseling, we have personal counseling, also referral to mental health providers as needed. Alternatives considered, the mom did not want to consider medication, so definitely we're looking at cognitive behavioral therapy and other types of therapies available that would help this young man process grief. This does incorporate many of Gene Watson's character factors, such as developing a helping trust relationship, promoting an expression of feelings, promoting a supportive environment, assisting with the gratification of human needs, and the science of caring, meaning that this is all not just treating the mental status, but also looking at the patient from a whole perspective and knowing that the mental status is connected to the whole body. If the person is depressed, the person is unable to function, the person is not taking care of themselves, they're not eating, they're not doing activities of daily living, they're not exercising, and so that becomes a trickle-down effect that can cause issues in other parts of the body, especially as he is a growing young man. It's important to tackle it early. One thing that is important to note, that depression at this age is often difficult to diagnose because children at this age are going through different stages of life, and a lot of times their mood are changing quickly due to how they relate with their environment. And sometimes diagnosis of depression is overlooked, and it takes someone that is really close to them to see a difference in their day-to-day going, or knowing that there is a significant change. And in his case, that was a significant change with the loss of his father. So I thank you for your time, and that's the end of my week 6 soap note. Thank you.